This one's going to be a little tough, but someone's helping me do it. So, postpartum depression, also called PPD, is a medical condition that many women get after birth of having their baby. It's strong feelings of sadness, anxiety, I'd add worry, tiredness, that lasts for a long time after giving birth. These feelings can make it hard for you to take care of yourself and your baby. Those who develop postpartum depression are even at greater risk of developing major depression later on in their life. Symptoms include things like insomnia, loss of appetite, intense irritability, difficulty even bonding with your baby. Untreated, the condition may last, months or longer. Treatment can include, counseling, antidepressant, even there's like hormone therapy now. But I want you to understand that there are 3 types of postpartum, okay? There's the blues, then there's depression, and, then there's psychosis, which is the last is a cluster of like compound feelings as well as obsessive-compulsive symptoms, during the postpartum period. In fact, postpartum psychosis is the severest form of mental illness in that category, characterized, by extreme confusion, I'd say loss of touch with reality, paranoia, delusions, disorganized thought process, and hallucinations. There are 3 stages of psychosis too. There's the typical course of like the initial psychotic episode and can conceptualize as occurring in each phase. There's the predominal phase, then there's like the acute phase, and then there's like the recovery phase. Generally, a psychotic episode will look like this. A person's, thoughts will be confused. Their words and ideas lose their meaning or take on a meaning that makes no sense anyway. These disturbances in thinking can affect a person's ability to concentrate, remember things and make plans. Before I go in depth, though, a little I will share of a touch of personal history example of what it may look like with the postpartum phase. I want more women, though, to be brave to talk about their experiences, to share and help other women. So with Tatiana, my first, nothing really sticks out, even as a new teen mom. And I think it's because I had a lot of hands-on support. However, with CJ, I had moved across country because of my then husband in the military. I'm away from family and friends, and he's out to sea. I remember specifically CJ having colic, the extreme sleep deprivation. I recall neighbors coming wanting to, see the baby. I had very dark circles under my eyes, in the same pajamas and bathrobe for a few days, and maybe didn't brush my teeth or, maybe didn't brush my hair. But now with Isaiah, I don't know, again, anything. I think it was because I had moved back home and had a lot of hands-on support then. However, Whittle, I recall extreme feelings of fear and anxiety. First her coming prematurely, so I couldn't take her home. And then in my head, I'm like, I don't have a home to take her to because I wasn't prepared. Intense inadequacy, super critical of myself for not having the things. The nursery wasn't set up. I was comparing myself even to when I first became a mom as a teen, thinking, how come then, you had it together, you were prepared mentally, physically. It then only fueled the dark thoughts of self. I remember a specific episode of how many times I kept saying and doing, if I just take a bath, I will feel better. This profound, it was like a compulsion. And how many times I couldn't control the feeling of wanting to feel better, and I kept taking baths repeatedly, throughout the day and night, even over and over again. It was a feeling of physical and mental anguish for sure, plus exhaustion, and to me that's a real example. Thank God I didn't jump out a window or hurt my baby, but unfortunately there are several mothers that do. It's imperative that we look out for one another, when we have a dark phase, so we can receive support before we then move into a phase that's darker, right? It depends on the case, though. There are so many scenarios and even thought-provoking patterns that can lead to tragedy. Sometimes new mothers simply need to be separated from their babies briefly, like when, for instance, a mother doesn't know what's going on in her mind, because too many statistics say a percentage will commit infanticide and another percentage will commit suicide. Most people don't even know what postpartum psychosis is. Also, many don't know how many cases are now leading to dead babies or dead moms. What about even saving, their own children for untreated past trauma? If you feel like something is off with your partner, you talk to them. I mean, we should be already, but especially when they need help. And right fucking then. If it's an emergency, treat it like one. There's absolutely is mental emergency, much like physical, that if not treated will lead to physical. It's important for partners especially to pay attention, encourage and have awareness when they don't look, act, or sound okay. If your partner is not normally, I'd say, violent and or confrontational, but suddenly starts acting that way to partner or kids, that is a red flag. Or when their eyes are bloodshot, they're talking funny and they're appearing drowsy at times, notice that is a warning sign. A young mother becoming, a mother of several babies, like back to back, is even a risk factor. It's a common misconception that the full spectrum of mental illness can't arise after childbirth. There is, the baby blues, the hormones just crash and burn. Go from this real high feeling like elated to a real low, like a weepy, uncontrollable sadness. By the way, baby blues itself is very common and happens to 3 out of every 4 women. But symptoms of just that go away generally, 2 to 3 weeks after. Aside from that, there is more serious postpartum depression during the first, I'd say, 6 weeks. Sleep deprivation is a key risk factor. Also having childhood trauma, too. But panic attacks and anxiety, if you already had that existed before, can and will arise then. A lot of these cases on TV and in the media are wondering, how did they come from a place of like giving birth even to a baby they really wanted to the events that can occur? It's fascinating and tragic, isn't it? Because, also notice, it's often 3 babies and not just 1. And ultimately, because it's 3 babies, not just 1, we end up vilifying her 3 times as much. These women, with multiple very young children, overwhelmed, can't cope, even suicidal. It's this epidemic of like mothers killing their babies that had 2 or 3 kids. Barely a year apart. Another common misconception with postpartum psychosis is just, it's really bad postpartum depression. I want you to know, though, baby blues doesn't get worse, and then it's depression, and then it's psychosis. They are all 3 very, very different and specific altogether diagnosis criteria. Mental illness is a beast, and postpartum is a nasty bitch. Here is a relatable comparison. How about, it's not like a work week you have experienced, even pulling 80 hours a week. You may be feeling at some point like you're dying. But postpartum blues, feeling like you got hit by a bus and then you want to kill yourself. If you can also can get this like uncontrollable thoughts and harming yourself and or baby, or even about giving your baby away. Things you actually wouldn't even do, but imagine how ashamed you can feel just for thinking that. And then, of course, we are having these thoughts, then terrified to tell anyone it is because we are now literally scared to death over judgment from someone else, even their reaction too. Sometimes it's the mom, even thinking the baby is evil. It can and does at times become a psychiatric emergency. It's a complete break with reality, really, and hearing voices or seeing delusions, like things that are not actually even there, even losing the ability to distinguish reality versus a hallucination. Trying to imagine they are already, hypersensitive, overcritical, and then, themselves and their situation, fearful that they should only be, so happy. I mean, brand new baby, right? Wondering, why do I feel so horrible? Too often, though, it becomes the dark, dirty secret. But more people need to understand. It's a disease that seeps into the mind and then into the family. We need to start feeling more safe, all of us, to talk about our feelings, all of them, even the most hard to hear and maybe even hard to understand. First, ultimately, to your partner, and or, family, if you have a best friend or a neighbor that you're close to. But also, how else can we spread awareness, right? Save ultimately lives, even our infants and our children. And then, of course, the parents and what becomes of their lives, too. All of us can only understand so much, but it's the present and the baggage carried into parenting. How many cases had clear signs or ignored alerts? Who had thoughts that it would be a great idea to have a woman with, significant past trauma, usually as a child, herself back at home, by herself, with a 2.5-year-old, a 1-year-old, and a newborn. I mean, we should be alone in a place with this ratio on any given date, let alone nobody. Day after day, even long hours with no breaks or help. Oh, and all throughout the night too. This is a prescription for disaster, and yet we expect this of mothers every day. When we expect them to look nice, then we want the house clean, the kids well taken care of, and a nice meal on the table ready at dinner time. I mean, who among us is so hardy and healthy, even strong enough to go into parenting with one little one, let alone with 3 little kids in isolation, alone? To me, that just seems overwhelmingly worse. The expectation, though, of society is a system that is set up for failure. The big expectation, all moms can do this and be alone, by themselves, is a stigma that needs to change, because all moms need support, whether one or several children, I think it's that expectation, though, that needs to change, especially postpartum. After a woman gives birth, if we could just have all hands on deck for that grace we are supposed to give. What is it the doctor says? The first 6 weeks, no sex, no lifting, you need to rest and recover. I think Medea's bit, it was hilarious. I heard a couple days ago when she said take 5 milligrams and don't choke nobody. But there actually is, more importantly, a 5 rule for postpartum. It can also help you recover safely to avoid postpartum injuries. And, it reduces risks of things like depression and anxiety, clogged milk ducts, and mastitis. The basics of the rule, though, is consists of 5 days in bed, and then there's 5 days on the bed, and then 5 days around the bed. There's also the 40-day rule after birth, more common in the Middle East. Resting 40 days after given birth is customary in like Jordan, Lebanon, Egypt. During this 40 days period, someone comes to the house or stays with the new mom to take care of the baby, the house, and the other children, so that all new moms, have the rest that they need. This should be done everywhere, okay? But are we making sure this new mom is getting any of that and not being left alone? Certainly not for long periods of time. We got to get out of that mindset that motherhood is a sport. That shift is necessary, not just give a new mom praise, ask the mom if she needs help, and then see that she gets it. Either you help her or see that someone else is, right? I will offer a few other common scenarios. When a mom wakes up to her crying baby or puts down one child and then another wakes up. Then you got the husband who's, likely works long, hard hours to support the family, that also wakes up when the baby is crying, but he gets frustrated and complains, because he wants sleep, and it causes a fight, which then wakes everybody back up. Now it's even more to deal with, and late at night and tired, that can be really rough. And puts a lot of strain on that relationship too. Even if mom tries hard to do more, puts the kids in daycare, so she can work and help out, or she wants to continue her education, so more money can be made, later in the future. Well, the workload has increased even more then, hasn't it? Anyway, you slice it anyway, and it makes me think of the expression, the road to hell is paved with good intentions. I see the big picture, though. Well, God says we should be fruitful and multiply. Yes, but why are we imposing ourselves this imaginary crunch line where you are supposed to have all your kids so close together, too? Sometimes we are not in the best position to start with taking on one child. So shouldn't we consider postponing other children to be able to jump back and be able to provide for what we have and then maybe what we want? I have learned it is vital to work on your resources and increase them more first before having more children. Strengthen the marriage, and it is healthier, actually, statistically, to have your children further apart. In any age overall, for everyone, we may not be able to go back and do different, but we can encourage better for the future, right? The U.S. is one of the only developed nations, by the way, that does not have infanticide law. The only legal defense in a case involving postpartum psychosis is a not guilty by reason insanity plea. The criminal justice system gets to have a look to see the mental health in their cases. There is a statute to decide who and when, is insane. If you are found to be insane, you have a 100% defense against homicide or murder. Every state has their own statute. So the stakes are really high for the criminal justice system because you are, giving them the opportunity to walk away with a not guilty by reason of insanity. That possibility makes many of our statutes very nervous, our states too. They have clung to a 19th century definition of insanity. In 1843, his name was Mignatin. He was acquitted of a murder. Paranoid schizophrenic, was deemed insane and incapable of judging right from wrong. That case is still the basis today of modern day insanity. Statutes, half of our states right now have the so-called, right or wrong test for insanity all the time, or at the time of the crime, sorry. So the Mignatin statute states this: in order to be found to be mentally ill, the person has to prove they did not know right from wrong. These laws are the person who is in the throes of this deep mental illness is actually capable of thinking, logically between right from wrong. And from the medical point of view, by definition, somebody that is in the throes of this profound psychotic episode is not capable of rational thought. Our doctors laugh at it when you tell them, oh, this is how you tell if someone is insane or not. They also split the accused into two phases of a trial. There's the first is to determine guilt. The second is to determine sanity. Everybody will, get to look at all the details, like the possible planning, what was used, how it was done, a real look at all the evidence, and also consistently look at the changes in the suspect's demeanor, actually, through both phases of the trial. I find it very interesting often that the suspect forgets, the crime that even occurred, and even becomes traumatized. That's right, I've seen, and it's visually, you can see them while they're looking over this evidence, raw footage is shown. They have this, I don't believe I could have done this, their emotions are changing rapidly, hearing and seeing it all laid out in front of them for the first time. So I am going to end this, too, with very brief comparisons. I will give no opinion, and I am not encouraging anyone to judge, but I just want you to see how two similar cases in two different states were decided and then received, if any, justice. They both had the story of this atypical mother, could not believe, loving, attentive, engaged, by witnesses, but like hundreds of other mothers who killed their children, and, both suffered from postpartum psychosis. So we got case number one, example was jury trial, Andrea Yates. The DA asked for the death penalty even for her after she killed her 5 children. She was convicted of capital murder in 2002, but the jury refused the death penalty option. She was sentenced to life in prison, with the possibility of parole after 40 years. But then her conviction was overturned on appeal. She was found not guilty in 2006 by reason of insanity and sent to a Texas mental hospital where she remains today. Case number 2, though, was a judge trial. Carol Coronado in 2014. The defendant was suffering from a mental and or physical condition that significantly reduced culpability for the crime and was sentenced to 3 consecutive life sentences with no possibility of parole for killing her 3 young children. The judge may have agreed that treatment is needed, but that it will happen in state prison. The second case was unable to plead insanity, and she was reprimanded to Chowchilla. Furthermore, Carol's appeal to have her case heard by the Supreme Court was denied.